The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, and welcome to our webinar titled Emergency Child Care Systems, a Look from on the Ground. My name is Mindy Bennett, and I am the Interim Deputy Chief of Partnerships here at Child Care Aware of America. I just want to take a moment to welcome you all. And as we have people still joining us right now, I'll go ahead and let you know that this session is being recorded and that we will share it with you in a follow-up email along with a copy of the slides. The recording will also be housed on our website under the COVID-19 Hub. Our website can be found at www.childcareaware.org. We will have a question and answer session after our presenters are finished today. Please feel free throughout the entire webinar to ask your questions in the question box. We'll get to as many of those questions as possible during our question and answer time period. So feel free to ask your questions throughout. And with that, I want to introduce you now to Dr. Lynette Fraga. If you'll move to the next slide for me, Fallon. Lynette is our Executive Director at Child Care Aware of America. She began her career in early childhood as a teacher in an infant, toddler, and preschool classrooms, and has since held positions at the local, state, and national level within the nonprofit, corporate, and higher education sectors. She earned her doctoral degree in family studies from Kansas State University, a master's degree in human relations from the University of Oklahoma, and a bachelor's degree in special education from the University of Arizona. And now I'd like to turn it over to Lynette.
Thank you so much, Mindy, and thank you everyone for joining us today regarding the important topic of emergency child care. We know that the heroes supporting our first responders, healthcare workers, grocery clerks, pharmacists, and other worker heroes have been working night and day to ensure everything from technology to funding to food and all that is needed for families and their children across the United States is available. As the nation's leading voice for childcare, we are excited to bring together systems and data in the form of data trust to enable data leadership and continually elevate and transform childcare. While Child Care Aware of America doesn't endorse one particular solution over another, we have formed partnerships and collaborations to strengthen all aspects of childcare. While today's focus will be on technology, it's so much more than bits and bytes. It's about people. It's each of you working night and day in the face of this unprecedented time that we find ourselves in. Thank you for that work, and a special thank you to those you'll hear from today who have provided tools. Unfortunately, as this pandemic upends life for all of us, childcare providers are sometimes being forced to close their doors without the promise of support. COVID-19 threatens the ability of childcare providers to support healthcare workers and other essential workers, and they need support, as do parents. In these difficult times, it seems that sometimes concerning measures in childcare implementation are revealing themselves in various parts of the country. We believe, however, this is the time to ensure our children and our systems ensure safety, standards, and equity and equitable access. Childcare has become of significant interest to those with ideas about technology solutions. States are grappling with next steps given their shelter-in-place orders. Difficult decisions are being made that impact the safety of our children, whether in the home with family, friends, and neighbors, or in center or group settings. Some states have chosen to close centers altogether. Most shelter-in-place states have chosen to augment their standards with special waivers, pandemic certificates, or emergency child care center certificates. For many states, they are balancing care needs with the desire to ensure children, parents, and providers are cared for and protected. Equity. We seek to ensure that all families, particularly those in most need and most often underserved, especially for our emergency and essential workers, are not having to incur additional fees for referrals or placed into a system that might require a fee in the future, and that each and every family of essential personnel has access to safe and supported care. The same is true of our providers, whether they be home or center-based. Ensuring that providers can provide care safely and are given the resources, supports, equipment, and materials to provide this care safely is essential. And most important, whatever we do in difficult times can impact how we consider childcare in the future. How we carefully and deliberately make even technology and system choices today can create precedent for how we consider our childcare systems for tomorrow. Childcare Aware of America values child-centered, family-engaged, community-based, and equity-focused solutions, and we encourage us all to consider how we put those values into place as we navigate solutions today and for tomorrow. Again, thank you for joining us this afternoon, and we look forward to having this discussion. I'd like to introduce Matthew Henry, who is Chief Information Officer for Childcare Aware of America. Prior to coming to Childcare Aware of America, Matthew spent 13 years at La Tourneau University in Longview, Texas, as Chief Information Officer and Dean of Innovative Education. His responsibilities included the University Library, University Online Curriculum and Educational Technology, and the Information Technology Department. Matthew also created Minecraft summer camps that not only provided children a fun experience, but also used technology to build leadership skills. With more than 40 years of experience in information technology, Matthew has served as chair of the Council for Christian Colleges and Universities, a national information technology group that serves private faith-based schools, and as E-Committee chair at Independent Colleges and Universities of Texas, a nonprofit association that is a voice for Texas's fully accredited private colleges and universities. Matthew joined Childcare Aware of America in April 2019, and I welcome Matthew. Thank you, Matthew.
Thank you so much, Lynette. I'm humbled and very excited for the opportunities that each of you have continued to give and serve throughout the United States in the roles that you fill in each of these agencies, centers, and technology solutions and so forth. So thank you, and a big thank you. I know in some ways it may feel like we're in a Minecraft world and we're wondering. I know my son and daughter played Minecraft for many years, and it's to them it's a very interesting world, a very interesting time that we're in, as I'm sure all your sons and daughters and grandchildren and are experiencing as well. So a big thank you. Next slide, please. I wanted to start out today with some questions, and questions that we aren't looking for answers specifically, although I love dialoguing on technology, so would welcome. My contact information will be at the end of this presentation, and you're welcome to talk through those and help us understand together how we can serve together. But my overall question is, how are our technology systems doing? And some drill down questions is, for states offering emergency child care, what is the take rate? What is the take-up rate, demand versus the capacity to serve? What does that look like? What are our biggest technology challenges now, especially during a pandemic? And then how, as Lynette mentioned, how can technology protect the safety, the standards, and equity of both our families and their children, as well as our providers with the systems already in place? Next slide, please. To me, a lot of the answers to these questions come down to what I call a supply and demand equation. And I'm reminded every day that when it comes to childcare across the United States, this isn't a new COVID-19 problem. The supply and demand equation has been a question that we continue to have as we work every day. And related to that, some more questions. And again, questions I'd ask us to think deeply about as we are experiencing answers to these, even today, even maybe in the last hour, you've had to ask yourself these questions. Can we use the data? Can we use the data together? Can we create data trust? you'll be meeting an organization that has been involved in creating data trust around the United States for several years. Can we use interoperability? And what does that look like? Can we map and solve the supply and demand equation? And then I think my dream, my vision, especially in a situation like this, but again, this not being a new COVID-19 problem, what would a national dashboard look like? What would it look like to understand where families need care and then where care is available? And how would a national dashboard look? Next slide, please. With that said, many of you have met and talked with and been on webinars with Opportunities Exchange. I'm glad to introduce Sharon Easterling with Opportunities Exchange, and she will give us a quick update of the tools and opportunities that she and the work that they are doing have available. Sharon?
Thanks, Matthew. Next slide. So Opportunities Exchange, many of you probably know, is focused on kind of answering the question, how can we help childcare programs to not only offer high quality programming, but also be financially sustainable and address the vexing problem of staff compensation. And we see shared service alliances as a primary strategy for being able to improve business practices in childcare programs. The Iron Triangle, the sort of brainchild of Louise Stoney. And for the last several years, we have been working pretty relentlessly on promoting business automation. That is, trying to get providers to use and utilize all of the power of childcare management systems. And so that's the vantage point that we have in this conversation. We really believe that business automation tools can help childcare programs really run their businesses in a more strategic and ultimately a more sustainable way. And we have also entered into the conversation of how do we use data that is collected at the provider level to speak to and report to the public systems. And that's sort of the issue where we're standing in this moment, is trying to connect up data at the provider level to the systems that need to be able to understand what's happening in the larger childcare sector. So that's why Opportunities Exchange is here and why we've been working over the last couple of weeks to try to let people know about this new resource, and are available to speak with anyone who has questions about any of this. So thanks.
Thank you, Sharon, very much. I appreciate all the work you are doing in this area, especially with the things that you mentioned. Thank you very much. Next slide, please, Fallon. Next, I would glad to introduce David Goodman. He's the director of Data Trust with BrightHive. And David, I'll turn it over to you. And Fallon, next slide, please.
Thanks, Matthew. As Matthew said, my name is David Goodman. I lead the Data Trust team at BrightHive. We are a band of merry data nerds who have come together to address one of those dreadful components of widespread collaborative data trust, and that's data governance. We actually enjoy this work, and we've done it at many different levels with many different organizations and many different sectors. And we work predominantly to create what Matthew and Lynette mentioned earlier, which are called data trusts. And these are essentially the legal, technical, and ongoing governance components that allow individuals, organizations, communities, and networks to combine their own individual data to create combined resources that they maintain the control of, and they collectively decide how it's used, who it's used by, and for what purposes. This data governance is really critical at a time like this, because while some of these constraints around data privacy and data confidentiality may be alleviated a bit, we want to make sure that the work that your organization and your partners go into to combine and share and use your data is within a framework that is able to evolve with your needs, so that while it's critical to define how the data is used during this crisis, the framework can evolve with your needs so that you don't have to renegotiate agreements. You don't need to rebuild the infrastructure. You simply meet collectively to decide what's next. And you can use the existing agreements and infrastructure to continue to extract value out of your work together. So we'll be providing data governance during this emergency phase. We'll be providing a webinar on how to develop this and execute it with your partners. We'll have some consulting hours, and we'll have a how-to guide for you and your partners to use. We'll also be available to start anticipating how we then build off of this framework once the emergency subsides, and we want to continue to use this framework ongoing to address new questions, add new partners, and explore new relationships with data through childcare. Thank you.
Thank you, David, very much as well. Fallon, next slide, please. This slide I titled the 3x5 card and Google Sheet systems. As many of us know, the child care systems across America and in each state go from a provider all the way to agencies, all the way into state systems with licensing, quality ratings, and everything in between. We've found in many localities that some of these areas, some of these systems are very limited and are using limited systems that work, systems that have been serving, but have limited resources at this point during especially this COVID-19 pandemic. What you'll see in these next slides is some technology solutions specifically that have been able to deliver to these areas of the United States full systems that enable an emergency child care solution in a very short period of time, in 3 to 4 days. And again, as David mentioned with the data trust, the key that you'll see to a lot of this is interoperability between the systems. With that said, next slide, please, Fallon. I would like to introduce Sharia. She is the Director of Best Places for Kids in Tarrant County, Texas, and she has been involved, as you'll see, in standing up one of these emergency child care solutions for her county, and we wanted to frame this webinar with a look from the ground so that you could see what has been happening in places where there has been no or very little systems. So with that, Sharia, I would like to turn it over to you.
Thank you, Matthew. As Matthew indicated, I represent the Best Place for Kids, which is Fort Worth's whole community approach to impacting childhood and family outcomes through education and economic development initiatives. This effort exists to ensure 3 things: that every child has access to quality education starting at birth, that families are connected with key local resources, and that businesses are supported with strategies that benefit working parents and their bottom line. Making Fort Worth and the broader Tarrant County known as the Best Place for Kids has become the shared rallying point and the natural outgrowth of early education work that we've been committed to for the last 7 years. And because of this incredibly collaborative effort, Fort Worth is honored to be considered as a national leader in our approach to quality early education, being one of only 3 U.S. communities highlighted as a national model for early education. Part of that work is us increasing quality rated child care centers by 62% in the last 2 years, and having 3,000 child care professionals registered to work on an accredited career track. Keeping that in mind, the Best Place for Kids operates as a local private that builds on Fort Worth's cooperative nature, led by Fort Worth's mayor and other local partners, including the City of Fort Worth, philanthropic partners, nonprofits, business leaders, and experts in quality early learning and education policy. We're dedicated to lifting up innovative practices and broadening support for strategies that make Fort Worth the best place for kids. As a brief overview for those of you that have not been to Fort Worth yet, Fort Worth is the western bookend of the sprawling DFW Metroplex. We're just shy of 1 million people and are the fastest growing large city in the United States, with a fast growing economy, lots of arts, culture, heritage, and several higher ed institutions. We rank currently as the 13th largest city, which is, for perspective, larger than Boston. And most importantly for our discussion today, we boast the second highest percentage of families with children in the United States, which equates to about 482,000 families with children in Tarrant County. Next slide, please. As a brief overview for how we got to having a FIND, which is our child care search tool, Texas does not have a formal CCR&R network, but while the state doesn't fund an R&R, we do have a local workforce board who manages the child care subsidies in counties or multi-county areas, and quality improvement coaches who are working to improve quality child care with CCDF quality funds. However, we've never really had a way to create parent-facing connections with software, and we recognize the need for R&R specialists to be able to assist families that will help ultimately our community and state longer term. That being said, this child care search tool is something that we've been hoping to create for our county for several years. In fact, we've just been very simply hoping to answer, can I find open child care spots near my work and home? Next slide, please. In fact, we actually sponsored a bill with the City of Fort Worth's help last legislative session with a Fort Worth-based state rep requesting that the state of Texas build a search tool like the one you'll see shortly. However, that bill did not go through in 2019, but because we had done our homework and research, we had a rough idea of what it is that we would need and the kind of site we would hope to build out to serve our workforce families and child care providers. So when COVID arrived, we decided to ramp up the development and take it on ourselves in the light of our emergency needs. But to share with you briefly the why behind this approach is we believe that our essential industry workforce is critical to our community's ability to respond to this current pandemic. And we know that childcare is a critical feature of any disaster response. In fact, our county contacted childcare early to pull us in as a specific feature in our unified community response. Not only that, the best place for kids is motivated to helping working parents find safe and available childcare options for their children while they meet essential workforce needs. That's ultimately even more critical right now while we're all under stay-at-home orders, as well in Fort Worth and Tarrant County. Our collaborative push over the last 2 weeks to stand up FIND, as you'll see just briefly, involved local philanthropies, early education experts, child care providers, bridge care, 501 ops, and community leaders who worked tirelessly to create this unique community solution in anticipation of the intensified burden parents are facing in order to care for their children while meeting community needs. The way we've structured the initial rollout of this free childcare search tool is to serve our immediate needs during our community's response to COVID, which means that we're linking parents working at essential businesses while at stay-at-home orders with quality available childcare openings around their work or home. We rolled this out to essential businesses, which include hospitals, municipalities, first responders, but also involved grocery stores, gas stations, construction, and transportation industries. Parents employed by essential businesses can now access a searchable online tool providing real-time availability of childcare spots at licensed childcare centers in Tarrant County for children ranging from 0 to 12 years of age. For us, we're thrilled to see this tool be stood up in such a short amount of time for a variety of reasons, but the first of it being this tool goes beyond any existing search options for us. For parents seeking detailed information that includes availability and quality details on childcare options near their home and or work. Upon launch, which was, I guess, roughly last week, so the 30th of March, the FIND tool had identified over 7,700 available licensed childcare spots for kids ages 0 to 12 across Tarrant County, which at the time was only about 50% of the licensed childcare centers operational due to COVID. We knew all of this thanks to our local early education childcare navigators, who are our early education classroom mentors, after they logged over 1,200 hours over the last 2 weeks to prep for this, to establish childcare center data and availability. In fact, we converted early education class mentors who were now sitting at home due to these stay-at-home orders to become a critical point of contact for all open childcare programs and centers. Not only did they determine availability, but they also had a really unique sense of the critical needs, such as health and cleaning supplies that were lacking, that we were able to respond to as well. Currently, we're about to enter phase 2, so COVID essential personnel are now eligible for child care subsidy funds for a 3-month period. So essential workers can not only find child care, but also apply for financial assistance to cover direct costs associated with child care. It's actually, what I'm really amazed by is the subsidy application is a really simple form that can be filled out on a mobile phone. And we're also introducing this week to providers a simple way that they can begin to update their availability of childcare real time each day. Working hand in hand with our local workforce board, CCMS, elected officials, and community partners, the Find tool is serving as the external facing starting point for parents who need help finding childcare. And subsequently, we're thrilled that we can also support both the childcare centers themselves and other essential businesses that must continue to provide workforce support. I guess let me share with you briefly the impact before we demo the slide. But if we can go to the next slide. Over the last 2 weeks, the proof of concept was strong, and the state of Texas quickly adopted the same approach for statewide use in the light of COVID. We're thrilled to be considered pioneers in this effort, but honestly, we've learned so much as well through this process. Secondly, the folks at BridgeCare and Bowtie were able to help us turn our long envisioned goal into a reality in a remarkably short time frame. It allowed us to work with our trusted existing partners to collect meaningful raw data, for example, center availability, and bring in a hybrid innovative technology to provide tangible value to our community responding to this crisis. It also allowed our childcare providers, families, and businesses to know that they're being supported with modern real-time resource. Thirdly, this helped the Best Place for Kids answer a long-standing question of simply identifying quality childcare availability across Fort Worth and Tarrant County. And lastly, as Kara Waddell, the CEO of Child Care Associates, who manages the child care subsidies and QRIS work in our county, who sits on the Texas Governor's Board, providing solutions for frontline child care support during COVID. She really indicated that this sophisticated platform provides innovative technology and analytic capacity that nonprofits and local communities have never had access to. This solution has been especially crucial for informing our COVID-19 response because disaster relief is always local. And I'm just thrilled that we can offer this to our area and our families and the childcare providers themselves. And excited for you to see this tool that others will demo.
Thank you, Sharia. Very much appreciate your work, and thank you for your time and efforts in the Fort Worth area of Texas to serve all of these families, children, emergency workers, essential workers, and on down the list goes. So appreciative of your work. With that said, I would like to move into the demo phase, and the team knows that I like live demos, but they all said, oh, wait, we're not sure if those are going to actually work with all of our internet and Wi-Fi and every system being under stress. So we have screenshots of the live systems. We have links at the end of this webinar with the actual links of the systems you'll see that you can go and play with as well. And again, I think to stress and to reiterate what Sharia said about the necessary and the need of the CCR&R, the Resource and Referral Interface, that's so important and so critical in this technology solution. And as Lynette started this entire webinar saying, you know, technologists like myself, we love the bits and the bytes, but it's about the people and it's about the relationships. And so thank you, Sharia, for the work again that you've been doing. With that said, I would like to introduce Jamie. She's the CEO and co-founder of BridgeCare. And with that, she will demo we call her the front-end technologist to the solution, and she will demo that piece of it. So Jamie.
Yeah, thank you so much, Matthew. And Sharia, thank you very much for that opening into the solution. We go next slide, please. We're kind of big believers here that an important part of a solution is that people want to use it and are excited about what it can do for them. And so the front end of the parent experience and also the specialist experience, which I'll show you shortly as well, the navigator experience is really important to us. So Sharia talked about the value that it has brought, and I'm just going to walk you through what does this tool actually look like. And please know that it is adjustable largely for your area. I'll show you a couple examples coming up of how it's appeared in different areas. For example, the difference between Tarrant County and what they have versus Texas and how that works together. And we'll go from there. So this is what it looks like to start your search in Tarrant County with the Best Place for Kids Find tool. We provide a customized disclaimer at the beginning, especially for this emergency context, knowing that in all cases, the ideal is for children to stay with a family or someone close to them. However, that is not available for all. So those disclaimers are there. Families opt in that they are an essential worker. If you go to the next slide. And then they put in basic information about their child's needs. This could be a date of birth, or it could be just an age group selection, depending on preferences of the entity we're working with. They can put in more than one child and more than one age group if they have more than one child that need care at the same place. Next slide, please. And then they're able to put in where they're searching by, home, work, other, or along their commute, which when time is valuable, especially for working parents, this along the commute feature is truly valuable and distinct. So it will allow them to show based by drive, public transit, bike, or walking, how much time it will add to their commute for a particular option, because a space that is close by in proximity distance-wise may not be the best choice, particularly if you're talking about via public transit. And this is one of the ways that this is a big part of our equity piece of the solution. Also, there is the option to have a search by zip code. Again, optional, depending on the folks we're working with on the ground. And you can start to see how this is a flexible solution that is very quickly deployable, but also adjustable to the entity that we're working with and what their priorities are. Next slide, please. And then you'll see the next slide. Is it stuck? There we go. And then we'll see the search results. So as you can see, that was 3 quick screens. And actually, in the case of our Texas-wide solution, it's just 1 screen. So again, dynamic and flexible, depending on the organization we're working with. And here we are with your results. So you can see that the search is ranked by proximity, quality, and where there is availability. You can see here, although it's a little blurry, apologies for that, where there are open spots and also where accept subsidy as kind of top priority data points for our parent searchers. And then also you can see Texas Rising Star rating. So we do pull in the when available state quality rating and other metrics of quality that the local organizations want to prioritize. On a separate note, this serves as a really useful tool for parents, but it also serves as a way to push for quality rating overall, because these are the centers that are being able to be seen most. And so we can then really think about shifting behavior as well as a part of this solution. And that's where we really work with our local partners on the ground to see what are their priorities and how can we be helping them accomplish their goals, engaging with local providers and parents. Next slide, please. Then when you look at a single provider, this is where it really gets to be useful. So the previous slide is high-level overview and helps quickly filter your search results by what is relevant and accessible for parents. Then you can see where the commute time is. You can see availability real time by age groups. As you can see, this was as of today. This slide I recaptured today to make it current. Where available, we linked to the website, inspection reports, and also about 90% of our parent users search on their mobile phone. So while I do have computer screenshots up here, please know and feel free to test it out on your own phone, that we are what we call mobile first. So this is not an app. No one needs to download anything extra to their phone, but they can go to the website on their mobile phone, and it will be a great user experience. And it is designed to be used as such because it's usually and often late at night that parents are doing these kind of searches when their kids have gone to bed. And they can call directly. So this number button immediately transfers into a phone call. So all ways to make it really easy to use. We list license number as well to make sure that families know this is a safe and vetted option for them, and hours and age groups. Next slide, please. Just to give a couple other examples to see how the system can change with the desires of the organization. So in the statewide solution in Texas, you can see these little gray dots. Those are centers that don't have availability, different from the blue dots that do, and then different from the blue dots that have a gold star in them, which are available and have a quality rating. And you can see that all mapped out. And then they're kind of, the search results are ranked similarly to the color coding on the map. It's adjusted to the different branding and colors of the local organization we are working with. And some of you might be wondering, how does that work with one county in Texas having their own site and then a statewide site as well? And so what solution is being implemented there is what we're calling a no wrong door solution. So the information from Tarrant County is also on the statewide site, but Tarrant County has done more in terms of features and support for parents. So their tool is more robust, and because of the partnership with the folks on the ground supporting providers, there is more rich information in Tarrant County, and it really stands out as a leader in Texas because they are able to provide more. So my colleague Brian will talk next about how we're getting this data. But Texas-wide does a very good job, and Tarrant County does an excellent job. And that partnership is really, I think, to be highlighted, and why we have Shreya here on the call with us today. Next slide, please. This is my last one. We also have a navigator portal, and this is where it really gets special working with child care resource and referrals. This is a system that is implemented in Pennsylvania currently, in Allegheny County, where we will soon be rolling out with a parent portal like you just saw in Texas, but they also have a specialist portal where the folks on the ground from the local R&R are corresponding regularly with child care providers and parents to help them not just find care, but access resources, make sure they're supported, especially in this time. And that's what this portal looks like. So you can see it extracts a lot of the elements of the search tool, but then has a lot more to support the task management and flow of supporting parents and providers on the ground when you have those boots on the ground. And if anyone is interested in learning more about that, I'd be happy to tell you, but I'll leave it at that for now. And pass it over to Matthew to introduce our next partner.
Yes, thank you, Jamie, very much for that quick demo of the actual 3 systems that are up and running. With that, next slide, please. Would like to introduce Brian with Bowtie, and this is these solutions that you've seen. This is the back-end dashboard, the sort of data nerd information gathering dashboard type of work that we want to give a quick demo of what that looks like. So Brian, with that, go ahead, please.
Hi, everybody. Thank you, Matthew, David, Shreya, and Jamie. That was really excellent. And just to sort of level set where we are and where we've been, in the last 2 weeks, we've been able to roll out a system that enables you to see who has availability, who doesn't, where they are, what children they take, where they're located, and then map you from your location on your commute to that specific childcare location. That's absolutely incredible. So I can get lost in the ones and zeros quickly. As Matthew pointed out, I'm certainly a data geek, and I appreciate the data geek, but the usability of this is absolutely astonishing. And unfortunately, I'm going to take you from the very sexy, which is what I just mentioned, being able to see these locations on a map, to the unsexy, unsexy wiring behind the scenes. So if you would bring me to the next slide, that would be great. So there isn't really a way to show you plumbing or how electricity moves from the electricity generation out to your home and through your home to your washer and dryer and your stove and your water heaters. So the best way to do that is through knobs and dials, which is what I'm going to show you here. And what we're able to do through connectivity in a matter of hours and days is connect you with various systems. Some you may already have in place, some you may not have, to data that may exist in one silo or another in your operation or inside of another organization. And as well capture data that may not exist and pull it all together so that you have usable data. That makes this, from a system standpoint or data standpoint, interoperable, so that Tarrant County in Texas and the state of Texas can all operate off of the same data set, if you will. And that data set's governed, as David pointed out, by a data trust, so that certain data can be used only certain ways, etc. And that's governed by them. If you'll go to the next slide, what this is showing basically is the data that's coming in, who it's coming in by. In the previous slide, you saw what facilities were open and when. So Monday through Friday, quite a lot. Saturday and Sunday, not so many. You can see here how many of the child care centers are reporting, how many are not, where a majority of those are, and you'll see on the upper left-hand side that Tarrant County, which is Fort Worth, has the highest number of child care centers that are reporting in, followed by Harris County, which is Houston, Bear, San Antonio, and then Dallas, where I am. But speaking to the technology and the ease of use and it being about the people, what Tarrant has done is superior to what the state of Texas has done. And you can see that quite readily by the numbers. And it becomes really obvious as to how beneficial it is, not only to the child care providers, the R&R networks, but also, and most importantly, the parents and those that need child care. If you'll go to the next slide. So what we're looking at here is the aggregated data. So in terms of total number of providers at the top that are reporting in the state of Texas, there's about 3,200. In terms of parent searches to date, and this is about a week old, there's 1,100. Total counties represented 151. Total available spaces for children, 86,000. Infants, and that's divided into 4 categories. Infant at almost 13,000, toddler at almost 22,000, pre-K at almost 28,000, and school age at almost 25,000. On the graphs below, you'll see Texas and where those locations are located, and you'll see some solid dots and some hollow dots. And those hollow dots represent the child care centers that are not presenting data, and those that are. And what we can do, it's not shown here, but we can overlay where those child care centers are down to a zip code and frankly street address, where the demand is versus where the supply is. So if I was to show a hospital area, for example, where there might be high demand for first responders and essential workers with a dearth of available child care, that would be an obvious place for our network, the state, the county, and others to focus on. So if you'll go to the next slide, what makes all of this possible? What makes it possible to know who's open, who's closed, who has availability, at what age, where the demand is, where the supply is? All of that comes from data. We are agnostic in terms of providing the data, unless it's, of course, so long as it's through the data trust, and how it's presented. The way that BridgeCare has put it together in such a user-friendly way is one of the best we've seen. If your R&R network or state has other applications and are looking to tie other data in, we can help with that. But But what we were able to do, both from a data collection standpoint, where data existed in silos, where data didn't exist, so who has availability and who doesn't, that's capturing that data manually, pulling that into a system and showing that in a user interface that's very easy to use, dynamic and flexible. All of that took us 4 days. People have been working on these systems for years, and the team that I represent and that are on this phone were able to pull this off not only for Tarrant County, but for the entire state of Texas, and soon Allegheny County, which is Pennsylvania, and not a small population, mind you, with lots of data in lots of different silos. So as one would expect, there's likely a lift. You might think it's a heavy lift, but most of the burden is actually on us. And our job is to make it easy for you, to make it easy for the parents so that they can get childcare. And with that, Matthew, I'll turn it over to you so that we can wrap up and answer some questions. Thank you all very much.
Thank you, Brian, very much. Appreciate that introduction and overview of the dashboards and the interoperability and a little AI tossed in there. So Fallen, if you could go to the next slide, please. So at this point in our webinar, we would like to open, and I'll turn it back to Mindy to open it for questions. Mindy?
Terrific. Yes, thank you so much. The first question that we've gotten has been asked by a couple of different people in a couple of different ways. Matthew, I was wondering if you could explain how this system would work with NDS or Work-Life Systems or any of the other data systems that our child care resource and referral partners across the nation are using.
Yes, thank you. Great question. And Fallen, if you could just back up one slide, that would be great. How Brian explained the back end, if you can imagine in a model like this, where any of the existing not only systems but data, and as we talked early on, that data sometimes exists in a Google Sheet or an Excel spreadsheet. The interoperability piece and the probably larger maybe piece to that is this circle in the middle called a data trust, because as that data needs to move back and forth, there has to be governance and stipulations put in place where, for example, the licensing database may be outside of an R&R system, or a various information from a provider or something may be in another part of a data system. So that's why we have worked together with these solutions to, first of all, look at the data and what that data trust looks like, and ensure that that gets established. And as David mentioned, we are working and have worked through even what we call temporary data trust. But as Lynette outlined in the very beginning, this is not for us a temporary solution. This is establishing data trust, we hope, for a solid and a foundational future and for childcare across America. So would be glad to talk through any and all systems and how those integrations would fit. And I know you've seen slides from 3 systems actually that are in place, and each of those, as each of the demonstrators presented, have been put together in different ways with different data trust and with different systems working together. So great question. Would be glad to talk further about that for each of the needs.
Great, thanks, Matthew. And another question that we have, several folks have asked this. They want to know how is this system having providers update in real time? So a challenge that the child care resource and referral agencies across the nation have always had is getting actual capacity that has openings right this minute, within a day or 2 old. How is this system letting folks update their information?
And Sharia, I would pass that off to you. I think you have experienced this on the ground. If you want to take a stab at answering that question, that'd be great.
Yeah, I'll be happy to start. And on the tech side, if you want to back me up, that'd be great. Quite frankly, we set up a parent-facing website on the Best Place for Kids site, which that is indicated, that URL is indicated at the bottom of the screen. But we encourage providers who had questions or saw that their center had vacancies or needed to make changes or add their website, for instance, just email us. And we've been able to pass that off to both tech teams mentioned, both Bowtie and Bridge Care, and they've updated it. But at the same time, too, the longer term goal would be for the providers themselves to be able to make those changes themselves so that it could be truly real-time feedback.
And if I could interject here, this is Jamie. What we haven't begun doing yet in Tarrant County, because we've been working with the CCR, the local organization that is kind of acting like the RNR, we are taking a phased approach with them. But I'd love for Brian to talk about what we're doing for Texas wide, where they don't have that local on the ground support. And this is a great example of how we work with the organization in place to put together the right solution. It's not a one size fits all. Brian, do you want to speak to that?
Yeah, thanks, Jamie. Yeah, it's actually as simple as you might think. So we have the contact information, emails and phone numbers of the child care centers in the state of Texas, a little over 15,000 of them. We have phone numbers, so we're able to send emails and text messages. So many of these are closed, and we know they're closed because the state of Texas lets us know they're closed. Others we don't know, or others we know they're open. And then the question is, how many openings do they have and for what age group? So we send them an online form that backs up right into the database. It says, are you open, closed, your hours, and then of course, what availability you have, 0 to 3, 3 to 5, etc. They send that out, or they fill it out, hit send, and it's in our system immediately. We do that daily and we do it weekly. And we send reminders out on a weekly basis. And to my utter amazement, the feedback and the contributions have been off the charts. I was expecting somewhere around a 3 to 5% uptake in response to those. And of the facilities that were known, open, and responded, within a matter of a day, we had 50% of the feedback from all of those facilities, and within a week, nearly 100%. Certainly better than I've seen for most systems. I think that's probably a sign of the times, but it was nice to see. On a medium to longer term basis, there are several systems that most of these child care centers use. Most of those centers we're integrated with today. So over time, especially for the larger operations, we'll simply integrate to those and pull their data in real time, and they don't have to then fill out a form on a daily or weekly basis, or do it on their phone. It's even easier. So we can spin that up, get that data back to you again in a matter of hours, and it doesn't take much in the way of heavy lifting.
Thank you, Sharia, Jamie, and Brian. I think one other technology that we have, and I don't think we've implemented in the locality yet, but we also have what's referred to as conversational AI, where we have the data, we have the phone numbers, and we can actually place a call and walk through an AI system that can gather that information. So multiple ways, and would be glad to work with you on how the best way or options of ways would work in each of your situations. Mindy?
That's terrific. And I think this question was just answered, but I'll ask it again, just for us non-tech folks who may not have understood exactly what was just said. I think the answer to this is yes, but if a child care center is using a child care management system, can it be set up to pull vacancies and enrollment data right out of their systems with permission?
Yes. Absolutely.
You're correct, Mindy. That was exactly what Brian was just talking about. Like, that's the type of system we can pull from. Yep.
And this is Peter with Bowtie as well. Just one asterisk next to that. Yes, and we're in conversations with most of the major child management systems. However, some of them do not capture prospective vacancy. And that is in partnership in which we're helping them establish that without them needing to build it. So it is an effort ongoing, but it is the goal that within a short period of time that most major child management systems will have that functionality and be able to flow directly into this whole ecosystem.
And David, you want to give a thought in there on the data trust part of that?
Yeah, and again, so as in each context, the data providing organizations and those organizations that are critical to answering these important questions, they would become essentially data trust members. And not only would they control the use of their own data for these specific purposes, but collectively anything that is combined from more than two organizations, they would have a say in how that data is used and who uses it and for what purposes. So essentially, they all become members of a data trust, and they form a governance body that continues to meet, to manage, monitor, to ensure that anything that they have approved and decided upon is conducted and facilitated with fidelity, and that they can meet additionally to address new questions, bring in new partners, bring in new data, identify new users or new use cases. Everything is facilitated through that data trust governance board, and that is intended to both evolve with the needs of the members and be sustained over time.
Thank you, David. Mindy, maybe time for one more question?
Sure. So the next question is kind of a follow-up to what we've been talking about. Is there any type of checks and balances that are made for when a provider submits their capacity or other information? Does that have to be approved by someone, or can it go automatically into the system?
Jamie or Brian or even Sharia?
I can take that one. So it depends on what the piece of information is. Some of those bits of data, for example, license number or quality rating, are not allowed to be changed, of course. That information comes from a validated source and is not allowed to be changed by the provider. Some data depends on who we are working with. So for example, if it's a local CCR&R who wants providers to be able to update, for example, best phone number to contact. Whereas at the state level, working with licensing, they may not want that to be able to be changed unless it goes through licensing. So we take cues from the local organization that we're working with on what makes sense best for them. And then the availability information is updated by the provider.
Thank you, Jamie. And Mindy, with that, I'll turn it back over to you.
Yeah, absolutely. Thank you so much, everyone, and thank you to our presenters today. We know that we weren't able to get to every last question. We were able to summarize some of them and put them together, so hopefully you got most of your answers today. If you have additional questions, please do reach out to the links that are on the screen right now. When this webinar is finished, we will convert it into a recording and send this and a copy of the slides out to you, so you'll have the clickable slides so that you can click on the links that have been shared today. And with that, I just really want to thank you for your time and hope that you all stay safe, and we will talk with you soon. Thanks so very much.
Thank you, Mindy. Thanks, everyone.
Thank you, everybody.
Thank you.